Hello and welcome back to All Things Money. I'm your host, David Blain. And during this segment, we're going to continue our discussion of Medicare and Medicaid fraud and why it is and how we could potentially fix the problem and eliminate a lot of this fraud. I know recently there are companies such as American Express, your Visa card companies that process, millions of transactions that don't have the fraud levels that Medicare and Medicaid have, which we could take some lessons. But as I was alluding to in the last segment, we talked about Medicare being the largest purchaser of medical goods and services in the world, $572 billion in 2011. It pays 1.2 billion claims to 1.2 million healthcare providers on behalf of 47 million enrollees. And so if we look at the credit card industry and the number of transactions they process, it might be good to learn some lessons from them to reduce the fraud. So you've got 1.2 million providers punching these codes in, and a lot of this, before I move on, a lot of my data comes from Michael Cannon, an article that he published in National Review back in July, and he alludes to Medicare, the system, as a big ATM, where, a medical provider with a computer and these 1,000 codes just typing in and putting in these codes and getting money out. And the big question is, how does the government know that providers are withdrawing no more than the law allows? For example, prescription drugs are based on an average wholesale price, and that price is provided by the manufacturers. And, not to exclude, big pharma, that Teva Pharmaceuticals, Merck, several of these companies have settled claims brought by the government that they have been overcharging Medicare and Medicaid by artificially inflating the medical or the wholesale price of drugs. How does the Medicare system even know that these people are medical providers at all? In order to bill Medicare, the provider doesn't actually need to see any patients. All he has to do is have a computer, some billing software, some codes to match diagnosis and procedures, and he can purchase a list on the black market of Medicare and Medicaid recipients. And with that information, they just start typing numbers in and start billing for stuff. They just have to make sure that the procedures and the codes and all that match up correctly to what could be a legitimate procedure. And these lists of the recipients and things like that are out there for people to purchase. As an example, last year the feds indicted 44 members of an Armenian crime syndicate. They had this sprawling Medicare fraud scheme. They had 118 phony clinics and billed Medicare for about $35 million. Not only that, you have fraud on the provider side, people billing for stuff that doesn't take place, or what they call upcharging, billing for a motorized wheelchair when actually they gave the person an old manual wheelchair. There's just no way that an organization that large can monitor those type things. Let's not exclude the legal industry. The cottage industry of helping middle class or wealthy taxpayers qualify for Medicaid on paper is huge. We run into that in our industry. People come in and have been to an attorney and have this great Medicare planning in place so that they appear poor on paper. And there's certainly there's a lot of ethical issues surrounding that. But it's perfectly legal way to commit, to bilk the system out of money. The matching grant system is another way that politicians at the state level game the system. And I really had to study this to figure out how this works. But for example, when a state spends additional money on its Medicaid program, it receives a matching dollar from the federal government. And so low-income states can receive almost $3 an additional dollar they devote to Medicaid without limit. And so there was this one scam, and I call it a scam. It was legal, where the state increased Medicaid payment to hospitals, which triggered matching money from the federal government. In the same law, it increased its taxes on the hospital, so the tax receipts, the increased tax receipts would recoup the extra Medicaid money that they paid. So essentially it obtained more federal Medicaid money at no cost. And then it can use this extra money to pay for, bridges and things like that. And so all perfectly legal, but this is states gaming the system. So not only do you have criminals gaming the system, you have wealthy and middle-income taxpayers and lawyers gaming the system, appearing poor on paper to qualify for Medicaid, but you have states themselves gaming the system to get matching federal dollars at no expense to them. One of the things that this article highlighted was Vermont. Used this provider scam to bilk taxpayers in other states out of a couple $1 million, the way that it set up its laws. There's a great book by a guy by the name of Jim Frogue. It's called Stop Paying the Crooks, and it outlines a number of ways that states are using this matching grant system to defraud the federal government. In '93, Attorney General Janet Reno declared the healthcare fraud America's #2 crime problem after violent crime. Then we shift to the enforcement side. Both federal and state anti-fraud efforts are very, they're basically lame. I don't know how else to say it. They don't do a lot. Occasionally they'll come up with a big case, but a lot of times they refuse to prosecute, or they're not very aggressive at the pressure of politicians. For example, the federal government began poking around Buffalo School District that billed Medicaid for 4,000 speech therapy for their kids. Chuck Schumer, the Democrat of New York, basically shut that down. So we have people at all levels to blame for the huge Medicare and Medicaid fraud. And the Ryan plan, which would move to a block grant type system, is one way to solve this. But I present this to everyone out there, that Medicare and Medicaid fraud, as we look at the debt and the debt ceiling, this huge debate, that this is one area that seems like it would be fairly easy to clean up by changing the way that we do Medicare and Medicaid. Well, that's about all the time we have for today. Hopefully by the time you listen to this or watch it on TV, our debt ceiling will be raised. So we'll look forward to chatting with you again next week. For All Things Money, I'm David Blain.
The proceeding was a paid program. The opinions expressed are not necessarily those of WNBU and Inner Banks Media.